This is Steven with Real World Nursing, and today we're going to be talking about influenza, so let's get started. Now, real quick, influenza is the flu, which is a virus. Having the flu isn't just some catch-all word for sickness. It's a specific virus and symptoms. Once people get infected, it takes 1 to 4 days before symptoms start, but once it starts, everything happens quickly. So rapidly, during the flu in 1918, many people died the same day their symptoms started. It lasts 3 to 7 days. The testing is a lot like COVID testing. It's a rapid test or respiratory panel. You're contagious a day before the symptoms start and about 3 to 7 days after. It's sometimes longer. It spreads by aerosol droplets and lasts about a day outside the body. Coughing, sneezing, talking spreads them, and then touching something contaminated and then rubbing your eyes or nose is how you get infected. I'm telling you now, on the NCLEX, you'll have to know the precautions. Memorize this mnemonic: PIMP, pneumonia, influenza, meningitis, and pertussis. It's droplet, meaning you'll have to wear a mask and gown and gloves, and you'll never room an infected patient with a non-infected one unless they have the same disease and type. Now, colds are completely different than the flu. Colds are often from rhinovirus. The symptoms start gradually and last about 1 to 3 days. The hallmark is a runny nose. A cold is annoying but manageable. The flu is like literally being hit with a baseball bat. It's often mistaken for stomach bugs like norovirus, discovered in Norwalk, Ohio, called the winter vomiting sickness. It lasts 12 hours to 3 days with intense intestinal symptoms like vomiting and diarrhea. Typically, the flu doesn't cause diarrhea except in children. As nurses, you'll be dealing with sick people all the time, and you'll need to know how to distinguish the flu from other diseases. Just a couple of basic, simple questions like, how fast did your symptoms start? Or what symptoms are you having? You can start narrowing down the list. Now, influenza symptoms are systemic, meaning throughout the whole system. The classical triad includes fever, body aches, and chills. Body aches, the hallmark symptom. Fevers usually start high around 102 to 104. Any rebounding fever where it goes away and comes back is suspicious of complications. Headaches often resemble tension headaches. Earaches are common. Nausea and vomiting are more typically characteristic of stomach bugs, but can happen. Runny nose and congestion. As for coughing, it should be diminishing over time. Residual coughing after the disease is common. Assessing their lung sounds is key. Are their lungs clear, coarse, diminished, or any expiratory wheezing? How's their breathing? Is there any dyspnea, shortness of breath, or accessory muscles? Your stethoscope is like a chest x-ray. Not literally, but it's telling you what's happening in their body. If you've been caring for the same flu patient for a day or two, and you can just hear their left lung becoming coarse, you can be certain on the chest x-ray, it will show something like effusion or opacities developing in their left lung. This is why continuity of care is so critical, because if you don't report it or the next nurse doesn't think of it, they'll just think that's been their baseline. Now, as far as complications go, coughing can cause a patient with osteoporosis to fracture a rib. Coughing up blood or hemoptysis could happen, a bronchial tear. That's an emergency. You're going to want to get more people involved. Now, coughing up a little bit of blood is okay, but when it keeps coming, that's an emergency. Now, pneumonia is the king of complications. It drives the most flu-related deaths. It starts when mucus builds up in the lungs, turning them into a reservoir for infection. A key red flag of pneumonia is a worsening cough and rebounding fever. Typically, fevers and coughs start high and decrease after a few days. Any symptom that's getting progressively worse or coming back is concerning. Influenza just doesn't cause typical body aches. It can trigger myositis, an inflammation of the muscles. This causes the muscles to release a protein called myoglobin. During influenza-related myositis, a urine dipstick will give a false positive for blood because the myoglobin is so similar to the hemoglobin that it tricks the dipstick. This process is similar to statins and rhabdomyolysis, although much less severe. Earaches can also happen because of clogged sinuses. When they're clogged, bacteria gets trapped, sparking infections like otitis media. For testing on the NCLEX, Children can get Reye's syndrome, especially if aspirin is in the picture. The aspirin decreases liver function, causing a buildup of pneumonia, causing swelling in the brain, leading to encephalopathy. Now, for the flu season, the sun is key. UV rays degrade the virus and boost vitamin D production. This explains why some parts of Africa with consistent sunlight don't experience a flu season. In America, it typically runs from October to May. Winter winds damage the lining of the nose and causes people to come indoors, both increasing the rate of transmission. When it comes to the vaccine, the CDC recommends everyone over 6 months to be vaccinated. It's important to know the flu and MMR are made with eggs, so an egg allergy is contraindicated. One rare complication is Guillain-Barré. It's an acute disease that affects the nerves, can lead to paralysis. Priorities of these patients are not being able to urinate, so bladder scanning, and not being able to breathe. For the NCLEX, you're going to need to know what type of vaccine you're giving, the live attenuated or the inactivated. People who get the inactivated vaccines are listed in the video. It's important you know them for testing. When it comes to vaccinating children, you're going to need the coping strategies to ease the process, like distraction. Understand, the flu virus is constantly changing, much faster than vaccine manufacturers can predict. An antigenic shift is when they completely change protein structure, evading all prior vaccines. Now, when tackling influenza holistically, focus on supporting the body naturally. Start with the basics like hydration and sleep. You want fresh air, so open a window. In her book, Notes on Nursing, Florence describes fresh air as the first canon of nursing. Herbal teas like elderberry can increase the immune system. Thyme and ginger can help with breathing. Saline nasal sprays can clear out congested sinuses. Do not steam your sinuses with boiling water. I've seen people spill the water all over the place and get terrible cellulitis. Instead, a cool mist humidifier will help moisten the air and ease breathing. Clean it regularly to avoid mold. On supplements, zinc increases the immune system, which reduces the flu's time by about a day, which is the same amount of time for Tamiflu. Pair it with vitamin C. It's important to note that vitamin C and sugar compete for the same receptors. Decreasing sugar intake will help absorb vitamin C and will sap energy from the virus. Removing breads, carbohydrates, and alcohols, which get converted into sugar, will help. Now, for pharmaceutical treatment, it's still generally supportive. Medications like Tylenol and ibuprofen can address fevers and body aches. Pseudoephedrine is an adrenergic anti-sinus medication. Its toxicity includes insomnia. It's important to note it can increase your blood pressure by 5 to 15 points, so it's definitely contraindicated with anyone with hypertension. Breathing treatments, usually albuterol, can open the airways. A machine called a nebulizer turns it into a mist. There's a picture of a lady using a nebulizer. Mucinex needs to be taken with a full glass of water to effectively thin the mucus. Antitussives can suppress coughing. Antivirals like Tamiflu have a 48-hour window and may shorten the duration by, at best, 30%. Chlorhexidine mouthwash and mupirocin ointment can be prophylactic for pneumonia. Steroids like Solimedrol and prednisone are often prescribed to decrease inflammation in the lungs to facilitate breathing. This outweighs their negative effects on the immune system. Steroids also increase blood sugar, so it's critical to be monitoring and to be involved with diabetics and insulin. And there you have it, the real-world practical guide to influenza. Do this, like and subscribe, or you'll get a work email about a new charting system starting next week.